So, welcome to today's Lunch and Learn. I'm Sally from Henpicked. Absolutely delighted to be here today to talk about how to talk to your GP about menstrual health, because this is a topic we hear from many people when we're training, when we're talking to organisations around how challenging this can feel. And I'm absolutely delighted to join by one of our favourites on Lunch and Learn, Dr. Clare Spencer, who's a GP with an interest in women's health and a menopause specialist. So, Dr. Clare, welcome to today's session and thank you so much for joining us.
Oh no, thank you for inviting me. It's great to be talking about this lunchtime, Sally.
Fantastic. So I'm just getting onto the right screen. We just really wanted to just really kind of start the questions around and just kind of understanding, I guess, what the challenge is. Really kind of hearing the challenges that we experience. Um, and I think it's starting with the kind of facts of actually what is normal and when should someone seek medical advice. And I think this is something we hear time and time again from people saying that. Um, I'm just kind of struggling through. I'm thinking, well, this is just what periods are like. And actually, when is it that people should go and get the help and support from their GP?
Yes, that is a great question. And the answer is that is going to be really different for every single woman. So if we think about a normal menstrual cycle, in a normal menstrual cycle, our estrogen goes up and down twice, and then we bleed. Our progesterone only goes up and down in the second half of the cycle, and then we bleed. So, if we think about all the possibilities of what's happening, so let's start with bleeding. So, bleeding, the average length of a period is 2 to 7 days, with if you measure it in experimental conditions, the flow is anything between 20 and 90 mils of blood loss. But you might have a heavy period that you've always had and you've dealt with it, and to somebody else, that heavy period may be completely flooring them and making them not, and really interfering with quality of life. Cycle change can be anything, sorry, cycle length can be anything from 23 to 35 days. And again, it may be fine for you, it may be not for somebody else. It's very normal to get some period cramps, and they may be mild, they may be really horrible, completely interfere with function. You can't go to work and severe. And again, it's how it's impacting on function. You have to judge your symptoms and just do not be afraid to go and ask for help when it happens. And then there are times when we really do want to see you. So if you're having spotting in between a period and if you're bleeding after intercourse, that does need investigation. So there's a huge variation of what is normal, and there will be a huge variation in what is having an impact and interfering and what is not. And the minute something starts interfering is the minute to go. And you do not have to feel I've just got to put up with this. This is a woman's lot.
Yeah.
Please go and talk to somebody about symptoms, because there are so many ways of helping managing issues around periods.
Yeah, absolutely. And I think we often talk about that. We talk about if it's having an impact on your quality of life, whether that's
Mm,
at home or at work, if it's interfering with you being able to do day-to-day activities, that's a sign that there's something going on that, as you say, there may be a lot of things we can do to help with it. Because I think that's that people, we talk to will often say, well, everyone else seems to manage fine with their periods, so why don't I? And I think
mm.
that's something we need to help people overcome those fears of thinking it's okay to ask for help.
Absolutely. And unfortunately, historically over the last hundreds of years, women have not been positively managed sometimes when it comes to, so there's the sort of picture of a hysterical woman having hysteria premenstrually, or issues with moods and humors. But really, these are not good symptoms to be
Yeah.
having to deal with. And I think the tide has changed and continues to change. And it's so important that women are listened to, and then a judgment about treatment. And don't forget, heavy periods can have other knock-on effects like anemia and low iron, and that
Yeah.
can make you feel terribly tired. And so if you are having periods, it's important to just think about that as well. And again, the knock-on effects of menstrual change.
Yeah, absolutely. And so when people, because as we say, there is that fear about being dismissed or maybe experiences people have had in the past, but what is the best advice you can give to someone to really help them prepare to go and see their GP about their menstrual health?
Oh, that's a great question. So if you can keep a menstrual diary, it's really useful because we know that charting symptoms as you go along is a far more accurate way of having a good record than sort of looking back and doing it retrospectively. So if you can chart 2 cycles, particularly if mood is an issue before your period, to diagnose premenstrual dysphoric disorder or premenstrual tension, premenstrual syndrome, whatever you want to call it, we need 2 cycles.
Yeah.
So monitor the cycle, monitor the bleeding, monitor the mood, monitor physical symptoms. And as a doctor, I love it when somebody can show me a chart with all of these symptoms on, because you can really quickly, as well as listening, see what's happening. And it's a quicker route to getting where you need to be.
Yeah, absolutely. And I know I can see Deborah just asking chat around apps that people use to be able to track their symptoms. And I know people find those can be really useful just to, as you say, have that clear picture because it also maybe helps you to understand your body and your cycle better and understand where there are those challenges or particular times of the month. And as you say, for things like PMDD, that premenstrual dysphoric disorder, it's so important as part of the diagnosis, knowing where your symptoms are coming, which I think is, again, a really important point to get across.
Mm.
And I think as well, when we talk with in our training around this, that the talking about the impact it's having as well.
Yes.
You go and see your GP so that when something does feel like it's being minimized or anything like that, saying no, no, this is stopping me going to work, or this is stopping me going to school, or this is stopping me being able to socialize with my friends, or it's having an impact on my relationship because it really helps, I think, to demonstrate the seriousness of symptoms.
No, I completely agree, Sally. And I think going back to our first point of writing it all down, because there's often a lot to get through. You may feel pressure because, GP appointments are not hugely long, unfortunately. But you mustn't feel the pressure. But if you've got it all written down, it's easier to not forget, isn't it? When you're
Yeah.
thinking, right, I need to remember my bleeding. What symptoms am I having? What's the impact? And these are all totally valid. Do not minimize your symptoms. It's important, and it's important to get across to the doctor how important those symptoms are to you.
Yeah. And in terms of just kind of adding on to that a little bit, so in terms of talking clearly about symptoms and getting the most from that short appointment, any kind of top tips in how to get those points across?
Oh, you've just got to get it all out. Don't skirt around the issue. I know sometimes people can feel a little bit embarrassed about talking about periods and bleeding and function and sometimes sexual function. Just get it out there. Use the words that you're comfortable with. Your GP, or it might be a practice nurse, will not be embarrassable. And just say it as it is.
Yeah. Yeah. And I think that's really important because sometimes we don't feel like we have the words and it's okay to describe it in words, as you say, that feels right for you. It doesn't
Totally.
need to use technical terms and
No, 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 no.
this is one of the
Yeah.
challenges that we're going to come on to talk around the questions to ask your GP. I think there is a lot of terminology around menstrual cycles and menstrual health conditions. And you may hear things around, things like the luteal phase and the follicular phase and proliferative
Mm,
phase. It's like you
mm.
don't need to say I'm bleeding during the luteal phase. You say I'm bleeding or I'm really finding things really challenging in the luteal. Say, in the 2 weeks before my period, these are the
Yes.
symptoms I have. I
Yes.
think it's that not needing to use the technical terms. I think that's a really good bit of advice.
Yes, and in terms of heaviness of bleeding, it might feel really gross to talk about how often you're changing a pad, but I want to know how often are you changing a pad? Are you soaking through a Super Plus tampon? Are you being woken up at night? Are you soaking tampons and pads? How often are you doing that? Are there big clots? Being graphic
Yeah.
helps. Yeah.
Absolutely. And then in terms of the questions that you should ask your GP, so in particular, if you're wanting to understand the possible causes of symptoms, any investigations or diagnosis or treatment options, knowing what support's available, again, what kind of questions are the kind of right things to be asking?
Yes, that's quite good. And I've sort of reflected on this, and as I think asking, is this normal, is sort of helpful, but if it's normal to you, it doesn't matter. It's how it affects you as an individual. I think, does this need investigating? How are we going to investigate it? Do I need an examination? What other investigations might I need? What treatment can you offer me? If this doesn't work, what do we do next? Do I need to see a gynecologist? Are you comfortable managing this? Just so you can have the appreciation that your GP is being proactive
Yeah.
and looking for causes. So often with physical symptoms, a physical examination is often needed, and you might need to actually book in an appointment to come back and have a speculum examination to actually look at the genital tract and the cervix, and an internal examination for the GP to feel what's tender in your pelvis. And then often an ultrasound is useful. Ultrasound isn't 100% helpful, particularly at looking for endometriosis. Endometriosis, often for a formal diagnosis, would need a referral onto gynecology. So, can you refer me on to gynecology? Often there's months and months of waiting to get a gynecology appointment, and your GP might be able to start treatment while you're waiting. So, just on the topic of endometriosis, which we were talking earlier, was in the news, Emma Barnett's brilliant program this week. A lot of treatments like the pill, the mini pill, there are straightforward treatments that your GP can actually start while you're waiting, that it can be really helpful for your gynecologist to see. So it's not like they're masking symptoms, they're actual treatments for those conditions that could be helpful, helping make the diagnosis. So try and go with the flow, but don't be afraid to nudge the GP into, okay, can we refer now, or what do we do next?
Yeah, absolutely. Because yeah, even and I think sometimes we'll often hear from people saying that they're feeling dismissed by saying, "Oh, you just need to
Mm,
take the pill," but
yeah.
actually, the pill may actually help him manage symptoms, but still pushing to ensure that you are being referred and there is actually an understanding of what's causing those symptoms. So even if they're being managed, understanding, is it adenomyosis, endometriosis? What could be going on that's actually
Mm.
causing those symptoms? I think you both sometimes they can go hand in hand, especially when there is this length for diagnosis. And rather than someone struggling and suffering with symptoms, if there is something in the short term that might be able to help and support them, I think it's really important to recognize that.
Completely. So it's not, sometimes people say that, they're worried about being fobbed off with the pill, but actually the pill, if you can take it, or the mini pill or a Mirena coil, can be super helpful in helping work out what's going on in some ways. A little bit like, so it's really useful to be able to understand what's happening behind symptoms, just to agree with you, Sally. So I'm doing a lot of work at the moment on premenstrual syndrome and premenstrual dysphoric disorder. And I think so tracking those symptoms and then being able to talk through with your doctor what might be causing them can help you understand the best treatment. So, for example, when your progesterone goes up and down, when there's hormone change, when the estrogen is up and down, that really significant mood symptoms as well as physical symptoms can be triggered. And because of the neurochemical changes as a result of hormone change, antidepressants actually have a really helpful part to play in managing premenstrual syndrome. And because they increase the serotonin, and that is sometimes the change that is needed to help manage a cyclical change. So you may feel that you're just being given antidepressants, but actually, if you understand that they're helping redress some of the change made by the hormones, it can be more acceptable, and
Yeah.
again a helpful adjunct to making the diagnosis, if that makes sense.
Yeah,
Yeah.
absolutely. And I think it's feeling informed about the different treatment options. I
Mm.
know we had somebody once share with us that they've been diagnosed with fibroids and they spoke to their GP and their GP said, we can organize a hysterectomy. And they were
Mm.
like, is that
Whoa.
my only option? And
Yeah.
actually, once they questioned it and pushed back, and actually the symptom that was causing them the biggest challenge with fibroids was heavy bleeding. And actually, the Mirena coil was actually a really good solution for what they were struggling with. But they could have been taken down that route of a hysterectomy when actually maybe that wasn't what was needed. And so I think we will often talk about when we're talking about treatments, asking, why are you recommending this?
Yeah.
What are the alternatives?
Yeah.
What are the benefits? What are the potential risks? I think it's those. It's okay to question because we kind of look at our medical professionals as the experts on these things, and actually, I think asking those questions sometimes can be quite empowering, but quite scary to do sometimes.
Yes, no, absolutely. And but really do not be afraid to do so. And just, it'll help your GP sit back
Yeah,
and think. And we always say with the menopause, don't we, that if you don't get the right answers from one GP, don't be afraid to go back. And if there will almost certainly be a GP in your practice who has an interest in women's health.
yeah,
And now in many areas there are women's health hubs, which is a halfway house between your GP and a hospital consultant.
yeah.
And there you can have a little bit more time. There are GPs often who are more skilled in women's health issues. So
Absolutely.
absolutely,
Yeah,
yeah.
and someone's just popped in chat there around making sure your GP is aware of any other health issues you have. So asking in the appointment, have you reviewed my notes to understand my medical history? Because I think our bodies are complex, aren't they? And there could be many other things that are going on that intersect with how we're experiencing menstruation and menstrual health. So I think it's also okay to ask those things.
Absolutely. And that's why your GP is a good first port of call because they do have access to your medical records and should be able to see. But no, absolutely,
Yeah.
totally.
And then just thinking about the kind of next step. So if someone is referred on for further help and support, what would might someone expect and what can someone do to prepare or understand who they might be referred to and what that might entail?
So I think it really depends on what you're being referred for, because if we think of the whole gamut of sort of period issues, it may be that you have an issue with hormones and hormone balance. For example, what used to be called polycystic ovarian syndrome and is now called polyendocrine metabolic ovarian syndrome.
Yeah.
So that will have one set of
Yeah.
questions versus reaction to normal hormones like PMS, PMDD, heavy bleeding, or physical variations or abnormalities like fibroids, ovarian cysts, endometriosis, adenomyosis, endometrial polyps, abnormalities in bleeding. So it's sort of hard to generalize, but the same principles apply, Sally, as to the ones that you brought out. So, okay, what are my options? Can you talk me through the pros and cons of each option? What is going to suit me most? If this doesn't help, what are the next steps? What do we do next? What is the trajectory here? So it's making sure that you have all your answers to so you feel fully informed. Why is this happening to me?
Yeah.
Help it. I think in any condition, if you understand what's happening in the background, it helps you in some ways deal with it because you feel a little more in control. So it's making sure that you're being listened to, making sure that you're not being dismissed, making sure that you've got across the severity and the impact of your symptoms, and then working from there.
Absolutely. And I think as well, the understanding your own priorities can be really important in terms of where you are in life. Is it about managing pain? Is it about managing bleeding? Is it about fertility? I think
Mm.
there's, at different stages of life, people may, and different life choices, they may have different priorities. And so talking those through as well in terms of how does this impact on the pain that I'm in, or what does this mean in terms of planning for a family in the future if that's something I want to do. So I think again, exploring those can be really important.
Oh, absolutely. And even down to need for contraception. Well, this is a good option, but actually it's not contraceptive. So what am I going to do for contraception? What would you recommend? So
Yeah. Yeah.
absolutely.
Fantastic. So, Deborah, I can see there's lots of chat sharing and questions. And again, I know always really supportive, amazing audiences we have on our Henpicked sessions where people are sharing and things with everyone. But just want to see what kind of questions we've got coming through.
Absolutely, Sally. And this conversation is absolutely fascinating. We are making progress. It's great to see so many people now talking about menstruation and menstrual health. And Sally, there was a couple of things that you said that I thought, yep, absolutely. And the first one around not what is normal? The
Mm.
amount of training sessions that we run in organizations or awareness sessions where people say, I've learned more about my body in the last hour than I have in the last 40 years. Because you mentioned the word luteal phase. Many of us don't know what that is. It's the first time we've heard this. So it's a huge education, or the steep learning curve for so many of us. And I know somebody said to me, one of our team members the other day, kind of snapped at me and said, I'm really sorry, I'm in my luteal phase. And I was thinking, well, I know what that is, but if you'd have told me that before, or if I
Mm.
was a line manager and not had this education, I wouldn't have had a clue what you were talking about. So, we've still got a lot of progress to make these kind of the understanding of what's normal. And as you said, putting up with things is one thing, but also the language, how we describe it, and how those words become common parlance. I'm sure we'll all agree. 10 years ago, if you'd have said the word menopause, would have given you a very different reaction than if you say it now.
Mm.
So great progress on there. And yes, I a few questions coming up in chat. The one about the apps, right at the beginning, you were saying about tracking your cycle, and there were a few people coming up. I can see you're looking in chat now as well. We've got suggestions from Jade using Clue. We have Lou using, which one was it that Lou was using?
Stardust.
Stardust.
Stardust. I've never
Yeah.
heard of that one. And two apps, Cycles and Moody, and one of them, the Stardust one, that your partner can track it as well. I'm presuming that means so that they can remember to add period products to the shopping list rather than knowing to stay out of the house for a little bit longer or something like that. So great to see that. So tracking your cycle is absolutely paramount to having that good conversation with your GP. We've also got a couple of questions about the actual GP and an appreciation from Mo that you don't always see the same GP. So the question you asked before around have you read my
Mm.
health record is really important, but that's kind of also leads us on to the thought around Claire, you are an absolute ambassador for women's health, and it's a specialist interest, but it's something that you're also personally interested in. Have all doctors had training on this?
Yeah, so all medical students will have been through an obstetrics and gynecology placement. But that is hospital placement. Training has changed since I was a lass. And so medical students now are spending time in general practice as well. But then, so everybody has got some level of basic training, and it's part of the core curriculum for GPs as well. But obviously, it's a bit, being a general practitioner involves being a generalist. So there will be definitely, like, I have huge interest in women's health. So I see a lot of women's health in my practice, whereas, one of my partners has an interest in diabetes. So yes, there is training, and yes, there is now more training than there used to be, but you will still find variation from GP to GP. And that just reminds me of another point, of the person who was asking about, make sure they've seen your record. Sometimes, if you're not able to see the same GP, you might have tried lots of different treatments. And it is worth, as well as tracking symptoms, just keeping a list, particularly if you've been on 3 or 4 different combined pills, for example, because often the names are super not memorable. And there are loads of variations of names on the same product. So it is quite useful for when you go into that appointment. If somebody can tell me I've tried this, this, and this, because I can find it on your records, absolutely. But it is quite helpful
Yeah.
also.
Is it worth asking the question who in the practice is the best persons to speak to?
Absolutely 100% definitely. Yeah. And if you can ask for a double appointment, you won't always get a double appointment. And in the days now where we're triaging more of our own appointments, you may find it easier. But yeah, ask for a longer appointment if you can. Or go for the first appointment and then say, look, I recognize we are not going to bottom this out today. Can you give me another appointment, please? So
Yeah. Absolutely. So we've got a couple of questions on PMDD if I just jump in here.
Mm.
So Lou shared around it's the tracking, a partner being able to track is really helpful because she suffers with PMDD and it allows both of them to understand. And I think that that's so important around the um, recognition of that second half of the menstrual cycle being such a challenge with PMDD. But a couple of questions. So someone has PMDD, they're on low-level antidepressant for years to help with it. They're now on HRT, but still bleed. No one can tell me if I can stop taking the antidepressant or not. And so just kind of not obviously specific advice for her, but just that general, obviously menopause then comes in and kind of complicates. And if someone's on HRT, kind of at what stage if someone's taking a medication and they maybe think that maybe they don't need that anymore, is there any kind of guidance on how you might approach changing a medication or reducing or coming off a medication if you think it's not needed anymore? Any thoughts around that?
So specifically antidepressants. So antidepressants, as I said, can be hugely helpful in PMDD. And if you are there, if you then find hormones help as well, and you want to trial off antidepressants, you would reduce them super slowly unless you've been on them for just a very short amount of time. So my advice would be go and speak to your GP, or sometimes it's a clinical pharmacist. And if you're wondering how you feel off the antidepressants, the only way really is to check, but discuss it with them first. Because if you've had PMDD and you had many suicidal thoughts every month, I would really want to know why you want to stop the antidepressant, because you may get some symptoms back again. So it's got to be individualized, and it's got to be with the support of your doctor or clinical pharmacist.
Absolutely. And I think it's that recognition of how severe PMDD can be and that it's a
Absolutely.
recognized psychological disorder and it's really important people get the right support and help around that condition. And someone's talked about there being they've put pressurized by the GP to have the Mirena coil because they seem to be intolerant to progesterone. Would
Mm.
this help and will it affect my mood with PMDD?
Okay, so progesterone is an issue for women with PMDD, and it's often the change of progesterone as well as the presence of progesterone. The Mirena coil has a minimal but not zero systemic absorption, and that is greater in the first 2 or 3 months that you've had it fit. About 10% of women still don't tolerate a Mirena, but actually the vast majority of women do, particularly if you give the estrogen alongside. So the Mirena by itself is not that helpful for PMDD, but it is probably going to be tolerated. And then you need the estrogen alongside it. So it's worth a try, just because your blood level of progestogen will be a fraction of when you're swallowing it.
Fantastic. And I think there's a great charity that we work with called the PMDD Project that's got some really amazing resources on PMDD. So really encourage you to check
Yeah,
the resources there that are amazing. I think we've just got one question on PMOS as it is now.
yeah.
Just saying that they I won't go through everything on it, but they've had it for years. They've had loads of challenges around coil implant, multiple pills, tried to come off the pill to have a baby, horrendous 5 month straight period. Only way to stop the bleeding with tranexamic acid, menophthalmic acid, and
Desogestrel.
yeah. And they've been private and they've been told to double the dose of desogestrel, and no one had ever mentioned it before after having years of suffering with horrendous bleeding. And I think this is that thing of sometimes it takes that specialist person to be able to look at your individual case and look at what might be right for you.
Yes, absolutely agree. I'm sorry that you've had all of that suffering and have to go through all of those different treatments. But yes, it's finding the right person who can. Often you do have to work through many different
Yeah.
regimes to find the one that suits you, because there's often no test. But yeah,
Yeah. Absolutely. And just someone asked about signpost again, the NAPS, the National Association for Premenstrual
yes,
Syndrome.
I
It's
wanted
a
to mention
great,
that.
yeah, great
Yeah.
place to be able to go to, and we'll include those in the article and write up of today's session so people can access that as well, because there's some really great information there around supporting menstrual health. So I think that's really important. But I know we're getting to the end, Deborah. I think if we've covered most questions as much as we can do in half an hour.
I know. And, in terms of resources, because we finished there, you mentioned the PMDD project, Sally, which, of course, Henpicked and the Menopause and Menstruation Friendly Employer Awards raise money for every year. There are other resources. We've talked a lot about apps, and yes, we will include those in the transcript for this recording. So feel free to go into there. Claire, is there any other resources that you'd like to put in? Or Claire's just shared the PMS
Yeah,
download.
so pms.org.uk is NAPS, which is the National Association of Premenstrual Syndromes, and that's an amazingly supportive organisation as well, who I've done some work with.
Yeah.
Wonderful. And yes, we've all got to continue learning more about this. And I think for me, one of the big things is the more we talk about it, the more we highlight it. And I love the support that I can see in the chat for others that are struggling. You don't need to suffer in silence. Please do
No,
talk to somebody, and we hope you get all of the help that you need. So with that, Sally. Huge thanks to Sally Leach and to Dr. Claire Spencer, and thank you for joining us today. We look forward to speaking again. Thank you.
Thank you very
Hi
much.
everybody.